Tatiana, thank you so much, and we will keep tabs of that throughout the evening and have an update for you here later on WTOL. Ohio surpassing 3,000 COVID patients in the hospital yesterday, and the numbers continue to go up. So what are we seeing locally? We're joined this evening by Dr. Kaminski, Vice President of Quality and Patient Safety for ProMedica and a partner of the V Project. Doctor, thanks once again for joining us here on WTOL. So we know that more people are in the hospital with COVID. How is that impacting operations at our hospitals?
Yeah, so all hospitals across the region in our local area and across the state and across the country, they're all feeling part of this impact. And it really is a multifactorial thing, meaning that the COVID surge is part of this. We watched the Delta variant make its way through the south and place some pretty significant stressors on the hospitals down there. And it is making its way northward now. So we have and are experiencing a big surge of the Delta variant right now. It isn't as large of a surge as we've had in the past, but it is unusual because we're now combining it with a few other factors. So early on in the pandemic, we saw a lot of avoidance of the hospital. A lot of people weren't coming into our emergency centers, and there weren't a lot of people getting admitted to the hospital as a consequence. That's changed dramatically, again, across the state, the region, and across the country. So there's far more admitted patients in the hospital, far higher emergency department volume. And when you combine that with general staffing shortage and a bit of a COVID surge, it really is the perfect storm situation. So most of our hospitals are feeling significant stress. A part of that is the COVID surge, but these other things are playing a big role as well.
Doctor, let me ask, during the other parts of the pandemic, we saw hospitals that were canceling elective surgeries and procedures. Is that happening now? And if not, are we close to seeing it again?
Yeah, we haven't done that in the local area, and most hospitals really feel that we're in a position to provide a service to the community. And although some procedures might be described as elective, they're mostly necessary. So these are procedures that, in some cases, people have had delayed from the first wave of the pandemic, and now they're rescheduling. And to have them delayed again, really can potentially cause a significant degree of harm. So most hospitals in this area recognize their duty to the public and to remain operational and to continue to provide the service that the public expects. So we're utilizing all the surge mechanisms that we have and things that we do in situations where we're at high capacity, and we really don't want to go to that point where we're canceling elective procedures and rationing care and turning people away. We're trying to remain as close to normal operations as we can.
Doctor, we got about 30 seconds left. Let me ask you real quick. Friday night at Promenade Park and all weekend out at Inverness, there were huge gatherings. Should we temper our fears because these were outdoor events, or should we be concerned that there could be large community spread because of it?
Well, we definitely know that outdoor events are safer than indoor events, and that's been shown time and time again through the studies that we've been able to look at. So there is some reassurance that we can take from the fact that people were spending time gathering together, but outdoors. However, nothing is foolproof. Whenever you get groups of people together, there is always a risk of spread. In most cases, in large concerts that we've seen over the summer and large events, we haven't seen the type of transmission that we have indoors. So I think we do have a piece of reassurance there. And then the other part of this, we know that people are experiencing fatigue. We know that, most people have, become a little bit intolerant of some of these measures that are restrictive in nature, and so the world is starting to open up, and we haven't seen a lot of additional restrictions. So despite the fact that we are experiencing a surge right now, we can be reassured that we're still in the warmer months, and a lot of these events are outdoors, and that does limit the amount of spread.
All right, fingers crossed. Dr. Kaminski, good to see you. Thank you so much for joining us once again.
Thank you.
Overall, U.S. coronavirus infections this year have surpassed the country's entire case total for 2020, and the CDC